Hey, welcome back, everybody, to Good Day Tulsa. It's now 9:42. You know, at the Oklahoma Spine and Brain Institute, they are dedicated to providing the highest quality neurosurgical care possible, and that treatment often involves use of the Cyberknife. And this revolutionary computer-controlled radiosurgery reaches tumors that were previously untreatable. And this morning, we're welcoming Dr. Frank Tomecek to share some information about this new technology that's brought hope to a lot of folks. Doctor, thanks for coming in today.
Thanks, Keith.
We were talking about being a regular here lately. We're glad to have you back on today.
Glad to be here.
Now, you have been a neurosurgeon 15 years, right?
That's correct.
Okay. Now, you were telling me earlier, you're just fascinated by the Cyberknife and some of the things that you guys are able to do and utilize.
Yes, it is wonderful new technology. In the past, we've had radiosurgery for years, but in the past, we always had to put patients in frames that were very barbaric in a way. They had to have pins in their head, and they were awake when we were doing it, and it was very uncomfortable. And they had to wear those frames like halos all day to allow us to be able to program the computers to focus the radiation. Now with the Cyberknife, it's all frameless, so there's no pins, there's no pain, and it can be done much quicker and much more accurately than it ever could be done before. The Cyberknife uses a particle accelerator that is in the robotic arm that you see on the screen, and it focuses the beam using computer guidance directly at tumors in the brain. And the neat thing about the Cyberknife is it also can focus on tumors outside the brain, which is also new. It can focus on tumors in the lungs, even though the lungs are moving when we treat the patient. It can focus on tumors in the pancreas, liver, kidney, and we also can, of course, use it for treatment of tumors around the spinal cord and the spine.
Now, this technology is becoming more and more available, readily available throughout the world. But you were telling me here in Tulsa, we're blessed to have probably the most powerful and up-to-date Cyberknife in the world.
Yeah, we actually do. We have the most powerful unit that has been put into operation. We have the most updated technology that allows the radiation to be delivered more safe, more accurately, and quicker, so that in the past it might take several treatments and you might be spending several days of your life getting radiation therapy, but now it can be delivered in 45 minutes or less in one treatment frequently. And the patient can go home the same day and go back to work and go back to their normal life without the pain of pin sites and other things that are hampering them.
Now, you'll be talking about the Cyberknife, among other things, at the Women's Living Expo that's coming up. You'll be speaking on Saturday, is that right?
That's correct.
Okay.
And we look forward to that. It's a good time to go out and show people what is available that can help their different problems. And so, yeah, we will be there on Saturday, and our group will have a booth there for Oklahoma Spine and Brain Institute, talking about all the different types of treatment that we can offer throughout the weekend.
And you said you have, not only you guys try to be there as well, but some nurses will be manning that booth throughout the show so they can answer questions, talk to people, let them know what you guys do.
Exactly. That's exactly right.
Excellent. Well, sir, thank you very much. Appreciate you coming in.
Thank
you. The Oklahoma Spine and Brain Institute. They're located at 6802 South Olympia Avenue, Suite 300. It's Highway 75 and 71st Street. The Oklahoma Cyberknife, 949-6676. And you can go online and find out more information at the ospi.net. Also, 749-0762, and that is the number for OSPI if you have any further questions. Mike, absolutely unbelievable. That Cyberknife is something, isn't it?
Yeah, that is pretty cool. And also, it is